you speaking something?
Yeah, we'll start. Is it on live? Uh, Hello viewers. Good evening. My name is Shravanti. Welcome you all to the webinar Candid Conversations with your Care 360 partner. Today we are here to discuss on a topic preconception planning with new age, the faster paces and the development, like we see lot of fertility challenges in especially the Indian couples. At this juncture, like the preconception planning has become a very critical in one's life, in one's journey of fertility. We will delve into these things with our expert, Dr. Priyanka. Um, uh, yeah, Dr. Priyanka is a fertility expert and a gynecologist. She focuses on diagnosing and treating infertility in both men and women. She also provides comprehensive care for women's reproductive health, including pregnancy, childbirth. She is an MBBS and MS, and she also has certifications in DNB. She has done IVF fellowships, and she has expertise in endoscopic surgeries. Currently, doctor is working in Mumbai as a fertility expert. I would recommend the viewers to put in your queries in the comment section so that doctor can help us address those queries. Uh, Doctor, as we mentioned, right, with this current new age, we hear a lot of queries from our viewers that because of the fertility issues in the currently, like what are the few things that people should keep in mind while planning for pregnancy, and why is preconception planning very critical, and when one should what is the right time one should plan for this, at what age?
Firstly, thank you so much, Shavanti, for a warm welcome. I'm Dr. Priyanka. And have you asked me regarding like what are the things and why is it important to go for preconceptional counseling? Now preconception counseling has become a good trend. Actually, I should say a good trend because I'm addressing a lot of patients per day. At least we have two couples coming up to us and they are asking what are the various factors they should be looking upon, and so it should be actually made routine. Preconception counseling, it needs to be done because it provides you a window of opportunity to optimize your health. Like I mean there are a lot of couples, and since we are in this the era of constantly working and being into a constant stress, so it becomes very essential. Like if you're taking up such a like pregnancy is not a very easy decision to take up. So in those cases, it's very essential for a couple to know whether there are any shortcomings, as in every strata, like physically, are they ready enough or not, or mentally they are ready or not. So it is very important that a preconception counseling is done. Now, when what are the various things? I think first thing, if you are just thinking about a pregnancy, going for a preconception counseling with an empty head, a complete empty mind is very essential, so that you get a room for to gauge and to accept all that doctor is telling you or is asking you to get it done, and you understand that what are the various parameters that are required to embrace parenthood or motherhood for that matter.
Mhm.
So it is important that they go for it.
Okay. What to expect in the preconception counseling? I mean, would you recommend as a doctor like some key tests one should go through to assess the reproductive health and taking the necessary measures?
So usually when a couple comes to me, I recommend everyone when they are going for a preconception counseling. I wouldn't recommend us women, per se should go to their doctor and meet them. It's the couple that should always meet to the doctor. And when they meet, we take a very detailed history for both mother, to be mother for the couple, noting down every history, like are they suffering from any medical conditions, or did they have any past medical history, or if they had any surgical history, or were they given some, serious issues were there. Along with the taking histories of their those two individuals, we also take back the history of their families. Like, are there any serious illnesses that are present in their families or in their parents or mother? Like, they had any serious issue going on from generations, so that we can eliminate in the new forthcoming generations too. So yes, we take a first detailed history. Firstly, secondly, we do the slight examination, systemic examination of those two couple, whether they are fit or are there any issues. And of course, I'm a gynecologist, so I'll be focusing more on the female. So yes, physical well-being of the mother, to be mother, is very essential. So we also undergo various systemic examination. Now we talk about the blood test that we do. Now it is very specific. Now, when we demand the blood test, there are very few basic blood tests that every couple must undergo, especially the women. And those blood tests generally includes, the blood count. Simple and as easiest and the most common blood investigation that every doctor asks is to get a blood count. Now, someone we don't know, since we are always busy. I'm sure the younger generation always forgets to get those blood tests done on their routine days. However, post certain age, the elder citizens, older citizens generally get themselves evaluated. The younger ones never do. So when they come to us, first we do the ultrasound for every females to see their entire reproductive tract, whether their uterus is good enough or not, or their ovaries are, the status of the ovaries and the tubal status. So we see the entire reproductive tract of the female in order to, if there is any shortcoming, because most of the times most females are not aware that they have this problem. Sometimes some conditions, they are so silent. I mean, they not even suffer from any kind of pain or menstrual irregularity, and they yet exist in the and playing a very major role, to affect their reproductive life ahead in the future. So firstly, we do the ultrasound. Once that has been warranted and it's everything good and fair, then we also ask them to give to get few blood tests done. Now these blood tests, as I mentioned earlier, it's just as simple as a blood count. We try to do their blood groups. Then we do certain endocrinal evaluation of these females, like thyroid test, prolactin levels. And if some females, they come to me directly in their infertility, with the complaints of having irregular menstrual cycle, and now they want to plan up a pregnancy. In that case, we do certain other hormonal tests which needs to be done in order to understand what is the whole status of her, hormonal status. So that gives us a picture, whether, what are the various problems that she's been handling in since a long time, but since it was not much of a concern in the past because they don't wanted to take up pregnancy, so they try to neglect it. So how serious the issue is, so we with blood tests we get to pretty much understand what is their status. Also, in the preconception counseling, a lot of questions I get to from the patient, and I think most of the times they come to me for this similar doubts is for weight. Ma'am, should I reduce weight? Ma'am, should I gain weight? That's the most common question. So when I have to counsel my patient, I always ask them कि you should, of course, weight is a very important parameter that reflects not only preconceptionally during pregnancy and after one, but also it helps us, to have a very safe environment. So I always tell my patients to keep weight as a not as a target. कि नहीं मुझे I want to hit a target of 60 kg. I want to hit a target, according to the body proportion 65, 60, or if I so it should be an indicator. So someone who's very lean and they want to embrace pregnancy and they'll be like, ma'am, how much weight should I gain? Well, I say, please don't go there. Let's just not put the target, I'm a 40 and I have to hit 50 and then I'll embrace pregnancy. Because kab hoga, and then you will embrace pregnancy. It's a very long journey, and I don't want anybody to cut short onto their desires of having pregnancies just because their weight is not at the right target. So keeping it as an indicator will make a lot of difference. So if someone is underweight, I recommend them to maintain a very healthy lifestyle where keeping a balanced diet will help them to gain weight, and that way they can improve on the overall health rather than just keeping a body weight as a marker. Whereas someone is obese, of course, I will ask them to shed a little bit weight, but then not asking them to wait for their pregnancies to happen, just because they are a little overweight. So just because of that, just keeping it's just like, I think preconception counseling is a lot to do with, dealing with your myths that people usually hold it long way before. So dealing with that actually makes a lot of difference.
Okay. So, are there any myths or any taboo topics which your patients discuss with you with respect to the preconception planning? I mean, any such sort of questions you want to address in this forum?
Well, yes, one I mentioned is weight. Like, weight is the most overrated question that I keep getting in every OPD. And unfortunately, women take this as a big toll on their health, thinking about that if I am overweight, I will not be able to conceive. And which is a very sad part to hear because it's nothing to do with your pregnancy. Trust me, people with 140, 120 kg can also conceive easily and have and embrace pregnancy and motherhood. And it's not. So, one is weight, and that is how I try to deal with them. A lot of them, they have a very hectic schedule. So, a stress factor becomes a big time issue. So they think that, managing, I mean, they need to leave their job basically. Their first question is that do I need to cut on to my job hours? Or do I need to, leave my entire job or my working profile just to embrace pregnancy? Well, again, that's a big myth. That's what I question. Now, see, most of our females are pretty ambitious enough, so they some of them might not give up for the motherhood. They might give up motherhood, but they won't give up work, which is again a big myth. I mean, you can obviously balance your stressful, hectic life along with pregnancy by a slight modification or by trying to include various, healthy lifestyle options, I must say, in order to bring, in order to have both of them in your picture. So it is important that we do that way. And the second thing is like the exercise pattern. So a lot of people still, I don't know, it's a very strange thing to hear, but a lot of couples think that working out should not be taken up into picture before conceiving. Should I work out? Are there any specific exercises in order to enhance the chances of pregnancy? Well, again, that's a big myth. I don't think so. There are any form of exercise that can help you with pregnancy. A very thorough examination of a female in order to to understand whether their fertility index, I mean, that is very important rather than going for any type of exercises. Then food facts, I mean, this should not be eaten क्योंकि वो गर्म होता है. And there are various things like that come up as a myths to us, and we deal it on an everyday basis.
Mhm. Okay, all right. And if we can give our viewers the key checklists, like what they can follow as a planning phase of pregnancy. For example, you have mentioned exercises, healthy lifestyle. So, what are the key checklist? Maybe 5 to 10 pointers. Like, what are the key things one can follow?
Okay. Now, someone who is planning pregnancies, yes, let's just give, small pointers, I would say. Like, firstly, the vaccinations. I mean, I think that's very common, and most of us, thankfully, due to COVID, are all vaccinated. So, keeping up the recent influenza, the influenza keeps changing, the strains keep up changing. Like, recently, we had H3N2, before that, we had COVID. So, I recommend that if someone is wanting to have some vaccinations, to be done, you might as well just opt it before your pregnancy, not during it. Obviously, most of vaccines are not indicated during pregnancy, so you can offer vaccinations. You can also offer the influenza vaccines, like I said, and the HPV vaccine. For the very upcoming society are not very well aware of that, HPV vaccines can be taken before your pregnancy. Once you are done with the course, you are having, because like a lot of us don't know that it can be taken, and it can be taken at the early stage of your life. Even if you have crossed your window and you've been sexually active, post that also you can take up the HPV vaccine. So these vaccinations can be taken care of. Other than that, taking up supplements is also going to be a lot of help. And the most common supplement that you can take for yourself is folic acid. Like anyone who's planning for a pregnancy, someone who's never got pregnant, yes, they should take a month prior. They should at least a month prior. They should start on their folic acid supplements. How much and what is the dose? What are the various drug options that are available in the market? I'm sure you should first meet your gynecologist and then start taking it up. Other than that, supplements per se is not required. But if you have some vitamin deficiencies per se, like I mean, I still have a lot of younger generation coming up with me saying that I have vitamin B12 deficiencies, I have vitamin D deficiencies, calcium deficiencies. In those cases, we can address it priorly if you are coming for a preconception counseling. So that gets the benefit. Like if you are going for a preconception counseling, you can obviously determine these shortcomings and you can immediately address them at the same sitting. And they are not very big things. I'm not saying that these deficiencies will cause problem in their pregnancy, but getting them dealt much earlier before pregnancy will definitely help them, and that will be good for them. So yeah, and there are various. Suppose a mother, especially to be a mother, if a female is suffering from some health conditions on a prior, before pregnancy or before thinking of pregnancies. Now that could be anything. That is like if her thyroid levels are not at check, or if she has persistently low HB. Like her blood count has always been lower on the lower side, or she's been having thyroid disorders per se, or she has now because of the pieces the trend of diabetes, early diagnosis of diabetes has also come into picture. If she has those issues, or if she has diagnosed with raised blood pressure, because most of our generation choose pregnancy a much later stage of their life, so these metabolic or systemic conditions can come up late also. And if she's suffering from any of that, and if you, it's better for such females to please address your gynecologist much prior, because that will help to address the problem much earlier and optimize them. By diagnosing them, either you can be diagnosed at the preconceptional counseling, or you are already diagnosed with it and you want to just make it better or something compatible to your pregnancy, so that your at least pregnancy is not affected, the baby is not affected because of those conditions. Because most of these conditions like thyroids and diabetes or even blood pressure can lead to serious conditions like abortion in pregnancy. And I'm sure nobody would want to go through such a procedure or such a pain, of undergoing an abortion. So it's always recommended to go for these, evaluation, that whether they have any systemic or endocrinological, like thyroid or any other condition that matters.
So there is a lot of importance given to women's reproductive health. What is the role of the men? Like, um, um, what are the key things a male partner should look in terms of the pre-planning?
I think male partners play an important role. Why? One, because they're 50% responsible for having a baby. It just cannot be female. Of course, women have to be stronger from all the aspect, like physically, mentally, and socially. But other than that, male, firstly, they contribute the 50% of them into this. So, if you're giving your 50%, of your baby contribution to have the baby, then in that case, they should be right from the beginning. So, the biggest support they can give is mentally, I suppose. As a couple, as a partner, they should be present at every single visit when a female visits to their doctor, either before or during pregnancy. It's very important that you do that, because uh, pregnancy, as we all know, is a state of hormones. Like there is a sudden rise of certain hormones, and it's there's a certain surge of certain hormones at certain period of a day where it becomes really difficult for a female to handle it by herself. And having a complete mental support at their house, and a family support for that matter, really helps pregnancy to be a very nice and a very soothing process, the entire 9 months. And even before that, since we know that pregnancy is not anymore easygoing. Like I see it every single day. I see at least OPD of like so many patients, and I see that it's not no more an easygoing. It's so much of physical stress, so much of mental stress, and emotional for that matter. Like a lot of people challenge to have a baby. someone who embraces a baby, have pregnancies, but they constantly, unfortunate due to unfortunate events, they tend to lose their pregnancy. So in those issues, having a partner support is very essential, and understanding that there is not always, actually there is never a fault if you cannot have any of those things going on smoothly. So understanding them and keeping up with her actually helps a lot. So a male partner is very essential. I'd rather say that if you want a very healthy pregnancy ahead, a male partner to be equally involved is very essential.
Mhm, mhm. Okay, got it. And what is the right age to start planning for a family? I mean, why the question is like nowadays, women are getting married late because of various commitments, education, getting settled in their career. I mean, typically we see that the family planning starts after 30s. So I mean, what exactly would be the right age to start, or can a women plan before 30s? I mean, any key steps they can take. For example, nowadays we are hearing about egg freezing, all that. Like how does these play around?
Well, I don't want to put a time phase for any of a female. Like any of the female that is around us can pick up pregnancy. So for me, the right age to start planning for your motherhood is the time you have a thought. Like, should I consider pregnancy? If that question comes into your head, now then, once that question comes, that can come around 25, it can come around 30, it can come around 40, or even sometimes 45, what I see every single day. So the age is not a parameter. What I say is first a female needs to be mentally ready. That's yes. Now I need to pick up pregnancy. I want to be pregnant in my life and I want to embrace motherhood. And once that thought comes into progress, like into process, then yes, then we can decide accordingly. Someone who wants to have a pregnancy at an early age of 25, I say wonderful. I mean, because that becomes very easy for for us as doctors, because it's very easy and very smooth for them. Like, of course, yes, at a younger age, conceiving is a much easier option because your egg quality is good and the egg reserves are generally very fine. So it becomes easier for a doctor where he can expect that she will have a natural pregnancy. Now, when they decide this at a very later stage, it is difficult, but not. I would keep repeating and saying that it's not impossible. So yes, at the age of 40 also, if you want to pick up pregnancies, of course it's possible. Of course, the options vary. That it might not be a natural needs, but it could be from various other means, but it can be your baby only. So there is no right age. When you ask me again, if there's no right age, it's just that the mental setup of a female should be such that she's ready to pick up pregnancy. If she's ready, then we can go ahead, and counsel like how she can go about it. So like for a younger generation, like for 30s also, let's say till 35, if someone has a thought of getting pregnant now, well, the first thing we can do is like someone as simple as that, we have various tests that are easily available, and it's just like a click away. You can simply book a test and you can get those tests done. So one you can do is, of course, you have to visit your gynecologist in order to know what all these tests mean, like, and which is the most suitable test in her case. So you can just not pick by yourself, but yes, you should visit them and you can get the ultrasound done, or we have the various blood reports like AMH, anti-Mullerian hormone. Now, by this, we can actually assess our ovarian reserves. So, as a female, that really helps. And like I will recommend to go for those ovarian test reserves because which makes actually a difference. So, someone who is at the age of 30 and not yet married and they are just planning to get married and they are just worried ki, what if my pregnancy goes unevent what is going to be my sequential life in reproductive health. So in those cases I recommend to undergo these ovarian reserve tests, because that will help us to understand how much, like can they give a little more period of trying to get married and then take up the natural pregnancy. In such cases, like suppose she doesn't want to take up marriage right now and her ovarian test is done, and but it is a low count, like which is also very normal these days. Like I see a lot of females having a very low egg reserve on ovarian reserve. Then in those situations, you can offer the options like egg freezing. which is like it's no more myth that it is only for celebrities. Of course, our generation has also started embracing, and it's a very good thing that I see every single day. I at least not, I wouldn't say one single day. That would be a really nice thing if people of every single day, one female we have for egg freezing. But we still have once in 2 weeks, females coming up to the info center and asking for egg freezing, which is also a brilliant step that a working woman can pick up, and then eventually she can just freeze her eggs and keep it away, and whenever she wants to opt for motherhood, then she can immediately go and approach the similar IVF center where she had gone for the egg freezing. So can be easily done. Yeah.
Okay. Is there a life cycle or a time frame that the egg should be used within 5 years? Is there a time period to that egg freezing, or it can be done at any age?
We generally recommend someone who's at the borderline age. Now, someone who's 25, 26 comes to me and just says, "Ki, ma'am, please freeze my egg." Firstly, I will try to evaluate her ovarian reserve. If it's good enough, then I will ask her, please give yourself some time. Get married. You might never know. You might embrace easily. By the natural methods of conception, you may undergo and have pregnancy. But someone who is like, going beyond 30, I would definitely recommend those females to undergo ovarian reserve tests in order to understand how much is her AMH or the egg reserves or the AFC. There are various tests available. So with this, we can at least evaluate what is her ovarian status. So there's no per se age limit for which egg reserve, but definitely when you approach at a much later stage of your life, let's say around 40. Now the problem along with the egg count, we have the egg quality also into picture. So with age, we all know that the egg quality reduces. That's how the whole concept of, each and every male or a female, they have it in their head that, as we age, the quality reduces. Even if you have immense number of quantity, it really doesn't matter if the quality isn't at par as the quantity. So yes, at much later stages, it needs to be. Again, it's a very individualized decision. Someone can pick up that as an option at much later stage. But again, it has to be well balanced. Whether is it even required at the age of 42 or 45, where the egg reserve is reduced. Also, along with that, the quality of the eggs are very poor. So in those stages, it's not generally recommended. But someone who's in their 30s, yes, they can opt for egg freezing at an earlier stage.
Okay. So in this AMH, what are the safe zone? I mean, is there a number one should look at? Like if it is below certain specific threshold, one should worry about or take necessary measures. And apart from AMH, are there any advanced tests? For example, nowadays we hear a lot of PCOS or a PCOD cases, right? So, are there any other advanced tests one can go through to determine both the ovarian reserve and egg quality? And are there any other reasons for the infertilities? Yeah.
No. So the thing is that PCOS is very common these days. PCOS per se it is a separate entity. It's a condition that a female deals with it. So I wouldn't correlate with the AMH. Now, egg count. So we can only with ovarian reserve, we can only determine the count of the eggs that are available. And the tests like anti-Mullerian hormone and antral follicle counts, these are the two tests which we usually get it done in order to understand the egg reserve, means the count. Now, every female is born with a certain number of eggs itself, like beyond which she cannot produce further. Whereas in males, it's not the same. Every 3 months, a new generation happens. So for them, we can still give up medication and expect to increase their sperm count. Where in female cases, no medication can be actually given, although there are various recent studies coming up, in order to improve the egg reserve, but it's still into studies. It hasn't been approved. So I recommend that egg reserve, and generally the most easy method to determine is AMH, because that, and it's been considered that around 3 to 5 it's normal. Beyond 5, it's like you have a lot of egg count, and less than 3 is count as a reduced count. I wouldn't say poor, because poor is always determined as per the patient, and we always correlate. So nothing has been definite. I would not say like ऐसा बोला तो 3 के नीचे हुआ तो poor हो जाएगा. But it's a reduced count, or you're approaching towards that age where your egg count has started falling. So yes, the AMH helps you with that. But other than that, PCOS, see, so PC, an AMH count will help you understand whether are you suffering from PCOS or not. Like it can be an indicator, but it's not per se a diagnosis. Like if suppose generally PCOS patients tend to have a higher AMH, it doesn't mean that their egg count is way too much. It's just rather determines that they have a good egg count, but it's questionable whether they have a good quality eggs or not. So what we, the general myth that is always there that PCOS patient cannot get conceived naturally, which is a big myth, and I don't approve it of. Like I've seen so many PCOS patients getting pregnant, so it's a very nice thing that it does happen very smoothly. But yes, the egg quality is a bit challenge to overcome. So yes, that's one thing we have to deal with. So yeah, the if you want to just know your egg count, then AMH and antral follicle tests are very good. But if you want to know the quality of the egg, well, that's a very dicey situation. There are no blood tests, unfortunately, that have come up. But when we go for egg freezing, yes, the good quality eggs are only frozen, but somehow we froze the other eggs also. So we understand it through embryological observation rather than going for any tests.
Uh, so, what are the early symptoms one can look for infertility or reproductive health? I mean, are there any early symptoms? For example, PCOS sometimes can be diagnosed with the irregular periods or cycles, but sometimes, like, the women doesn't have or doesn't face the irregular cycles, but in the later stage she might diagnose with the PCOS. So are there any early symptoms like one could look for to determine or yeah.
See, there are not symptoms per se because so symptoms again, like you rightly said, Shravanti, because PCOS patients they always know that they have some reproductive issue. So someone who has irregular, I think menstrual cycle on a whole is a big picture for a gynecologist to pick up. What could be the possible issue with the female. So yes, when in your preconception counseling, I generally try to evaluate, their menstrual health also very important. Like how frequent their cycles are. Are they painful? Are they, is she bleeding for, beyond the designated number of days? Like, usually every normal individual bleeds around 4 to 5 days. Whether is she bleeding for more than 7 to 8 days? Is she having very heavy periods? So all this gives a picture to us, pretty much key what is her reproductive health. And yes, reproductive health is a very important index or a window to understand how is her fertility going to be ahead. So most of the females who are the chronic sufferers, their cycles are painful, they come to us, or they have irregular cycles, or they have been diagnosed with PCOS because of, the obvious signs of acne and history of the hair on face. So they understand by that yes, they are the PCOS patients. So those are certain set of patients who are they understand that they have this condition. And unfortunately, most of the times it is understood when they come to us for preconception counseling, where we simply do a scan and we understand, oh my God, now there's a cyst. Oh my God, you have a borderline PCOS. So PCOS is not always symptomatic. You may not always have acne, you may not be always obese, or you may not have hair over your face to diagnose you as PCOS or irregular cycle for that matter. So it's not always necessary that she needs to have symptoms, but sometimes it's a silent killer. वो रहता है पर कुछ समझ में नहीं आता. So when you go for your pre-conceptual counseling, yes, it's a very important thing you go for it because you understand whether is your reproductive health is good enough to have a normal pregnancy. So that can help you, and we can go about it.
Okay, sure. So, in this reproductive health, how is Care 360 helping the customers? Like, I mean, what is the value add given by or services provided by Care 360?
So, well, Care 360 is like we are the team of it, right? And so we are the one stop solution where we try to give you the complete comprehensive care that a female needs in order to take pregnancy or for her reproductive life ahead. So now that could be either you want a medical help. So we have the gynecologists around us. Well, just dealing with the medical experts will not help. Now you know the entire reproductive health is a combination of having a sane mind, a healthy body, and a healthy lifestyle for that matter. Like your pregnancy cannot be without just me giving you a popping up pills as a gynecologist. That's not going to help. Having a very sane and a very peaceful mind and having a healthy body can afford a very healthy pregnancy ahead. And most importantly, choosing a healthy diet lifestyle, which is, I think, really jeopardized and jinxed for that matter in our generation because of the lifestyles we have already opted for. Like our working patterns are day night, and the food options that we, even though we try to make it as healthy as possible, but we know how much we are successful in that. So we are trying to give you one stop solution where you can approach all of us together, and if you have any queries, you can interlink and make things better. So yeah, that's
Okay.
what we're trying to do
Yeah,
here.
sure. Before getting to my next question, I would just announcement to the viewers, if you have any queries for Dr. Priyanka or general reproductive health, pregnancy planning, please put in the questions in the comment section. We will address that. Uh, so, um, what my next question, doctor, is about what are the key contributors for the infertility in couples nowadays? Like, what are the key contributors wherein we haven't seen these kind of issues at the I mean, in our mothers, like the that age group. Nowadays we are hearing a lot of infertility problems. So what are the key contributors for this?
I think most important is the lifestyle. What we've been avoiding, like what are the life options? One second, just yeah. Am I audible?
Yes, you are.
Yeah. So I think one of the key factors that I'm sorry, not. I mean, the key factors for a couple, I think it's very important, is the lifestyle options. I think most of our generation is predisposed to westernization and everything. So yes, lifestyle options like smoking and alcohol consumption is a lot into picture. So the key contributor when you talk about for planning pregnancy ahead, yes, we need to of course cut down those things. So that's one thing which you can do it. And other things other than that is like again the caffeine consumption. So this is how we are going to approach in our preconceptional counseling, where we are going to modify your lifestyle changes, and these are the key contributors ahead in the pregnancies. So opting a good a lifestyle is very essential. So lifestyle is one thing. Secondly, if any so now that the pregnancies have been taken into picture much later stage of our lives, so yes, most of us suffering from certain conditions already because of the various options that we had chosen earlier. Could be either thyroid issues, or could be overweight, or could be diabetes. So yes, addressing them, that's also a key contributor. So optimization of those conditions is also very essential. So we approach to them as well.
Mm,
And of course the supplement, the filling up the gaps, that is by simply providing you the supplements, or the nutritional, approaching the nutritional deficiencies can also be very helpful. So yeah.
okay, all right. Uh, so, uh, when the women, I mean, things that I mean, they have to start the pregnancy planning, right? So, I mean, at what stage uh, should they get this AMH test, or is there a particular time frame in the period, like you recommend certain tests to be done so that they plan their pregnancy or intercourse at a right time, maybe at a right ovulation cycle? How does one can plan around this?
I mean, are you asking me how to the fertile window, the
Yes,
fertile period
yes.
during which the couples can? So generally, see, the fertile period is somewhere which is around the ovulation period of the female. Now, determining what is the ovulation period is only and only a gynae can do it well. Why? Because no female bleeds in a similar pattern. Not every female has a cycle of 28 to 30 days, which is a normal cycle. And even if it is, still the window period of that is not going to be same. At the same time, we must know that she's actually undergoing ovulation on. So yes, I recommend that if you want to understand the fertile period for an individual female, I would recommend them to first speak to their gynac and get an ultrasound done, so we understand. This is how she has a cycle, and so that they can figure out a certain fertile period for them. And having an intercourse in those periods can actually help. So we generally recommend. So if you ask me, not to complicate it further, we'll just say any days, like 3 days before and after your ovulation period is generally considered a very safe period where you can have your natural means of conception.
Okay.
And that could be done on daily basis. That's fine, but that can be helpful.
Okay, all right. So, also I wanted to check on, like, you also mentioned mental health of women should be kept in mind while planning for the family. If you can give us some insight on how it would help, like mental wellness of an individual.
See, actually, mental health a lot it plays a lot of role, especially when you're planning to have a pregnancy. And since we are seeing a sudden surge, I shouldn't say, quite a lot of cases these days who are having difficulty in conceiving. And I don't understand, but a society has always put that kind of a pressure on females. So that has jeopardized her mental health a lot. If she's not able to embrace motherhood, it comes a pressure. The whole pressure comes onto the female. Unfortunately, in spite of knowing the fact that 60% is the responsibility and 40% is female, not by the books, it used to be earlier 30% males and remaining for females. But now I see this, the equal ratio of male and female being responsible. So in that case, the pressure, unfortunately, even if there is on the other half, the cause is on the other half, yet she bears the brunt, and it really affects her mental health. So having a very harmonious environment around her, and a very healthy environment around her can actually help to take up pregnancy, and it actually impacts. And I have seen to the females, having a good family support and including a partner support has actually helped her get even if it's through the IVF methods, or any other artificial methods through which we can make her conceive. It's still successful, because even if you try to offer the options like the artificial reproductive technologies, it's not always 100%. They just offer it, but it's not always 100%. So in this journey where she is taking a lot of physical stress on her body, because when we go for these artificial techniques, even if we go for artificial, there are a lot of tests, there are a lot of injections, and a lot of physical stress that keeps on going on to the female. And so only a female, someone who's going through, will obviously understand. But it's very essential that the family, along with the partner, must understand that it's not easy for her to take up those physical stress, and she is trying to put her health at stake at every step. So it is very essential, and a support really helps throughout the pregnancy. So female doesn't and unfortunately and fortunately, I've seen so many cases, like a stress factor, a simple factor of stress or anxiety caused by the family members or near or dear ones can actually lead to early deliveries in the pregnancy, or abortions could be one of the reasons. So yes, it does matter.
Okay.
Having a sane mental health is really essential.
Mhm. Sure. On this note, Doctor, I would like to make an announcement for the next Candid Conversation session. We are planning for mental well-being in this fertility journey with another K360 partner, Miss Riddhi. So viewers, just subscribe to that free webinar, which is planned at the same time, 3 to 4 on 24th June. Thanks, Dr. Priyanka. It's a very valuable conversation. You have given us very insightful clarifications and some checklists the viewers can take back. Uh, Thank you so much.
Thank you, Sharanvi, so much for having me at Care 360.
Yeah,
Thank you.
thank you,
Hope
Doctor.
to see you soon. Yeah.